Fook was established in 1982 after 4 years of writing proposals. That was not easy. For a few years before that, a group of us Chinese professionals have actually been already meeting. We met for dim sum in Chinatown and talk about, what's happening in the community. And I got to hear that there are a lot of people who cannot get a mental health service just because they're Chinese, or because they have difficulty in understanding the system or using the language. So for me, that actually is very unfair, because we immigrants, we work hard, we pay tax, and yet we cannot get service. North America basically is made up by immigrants and refugees. So soon, over half of the Canada will be born outside the country. So it is a reality for the longest time. When you can imagine, your language is limited, you may feel embarrassed about your accent. You may have difficulty expressing yourself in the same way as a local Canadian. So communication is difficult even though you know the language. For an immigrant who is very isolated and sometimes having some racist remarks or other things, it is not a big step to jump into what is called paranoid symptoms. Feeling that people talk about you, feeling that people may hurt you. In fact, for a lot of immigrants and refugees, that is quite common to have paranoid symptoms. Research in England actually showed that not just the immigrants themselves, but their second generation and even third generation actually have a much higher incidence of schizophrenia than the local population. So you can see that actually the act of migration and the stress, which actually go through several generations. If you belong to a colored minority, a lot of times the way the institution is set up lead to racist practice. There's a controversial issues about the police and mentally ill patients, but that is particularly so with somebody who is colored. It's kind of a crisis. About professional resource, it is very limited in our population for the immigrants. Even our clinic, we have 8 months waiting list. Totally ridiculous, in my opinion. Ultimately, you cannot rely on just a psychiatrist. Actually, the real work is in the community. In the community, we see people earlier. If you get them early, and if they can manage that, I think they can do well. So it doesn't have to be such a big problem. But secondary prevention, which is to catch them early, is actually possible if there are enough education in the community and there are people who get concerned. And then there's talking about prevention, there's what we call tertiary, the third level of prevention, which is after they have the illness, how they can still recover. When I was in Hong Kong, I went to work in what is called Castle Peak Hospital, and that is the mental institution that a lot of places have. We have actually 2,000 patients in that hospital. The interesting thing is there was a woman psychiatrist who was from Shanghai actually, and she developed a farm just outside the hospital called New Life Farm. So I just got there. She said, "Can you help me?" So I said, "Okay." I didn't realize that she actually asked me to run the whole farm. To be able to do this project gave me a very, very different look at psychiatry. Because patients at that time, they would come down from the hospital to work in the farm, and later on we even have places where they would stay over. So many things psychiatric patients can do. So the fact that we can do something together, this is so wonderful. It inspired me to see that just sitting in an office or working in a hospital is not the only way psychiatry can work. It's only when the community can be activated and facilitated in developing services that meet the needs in a real way, the situation will not change. When the society can give a person a meaningful role, that is so important. My name's Ted Low, and I'm a psychiatrist in Toronto. I have been here for over 40 years. It's a long time.